Hello, and welcome to today's webinar, Personal Care Product Use Among Black Women and Latinas Living in an Environmental Justice Community. I am Dr. Barbara Malkus, Board President for Massachusetts Breast Cancer Coalition, and I'd like to thank you for joining us today. Massachusetts Breast Cancer Coalition is dedicated to preventing environmental causes of breast cancer through community education, research advocacy, and changes to public policy. I am pleased to welcome today's speaker, Dr. Robin Dodson. Dr. Dodson is Associate Director of Research Operations at Silent Spring Institute and a research scientist with expertise in exposure assessment, particularly in the indoor environment. Dr. Dodson is an adjunct assistant professor of environmental health at Boston University School of Public Health and also holds an appointment as a visiting scientist at Harvard T.H. School of Public Health. Dr. Dodson, welcome to MBCC's webinar. I'm going to let you take it away.
Great. Well, thank you. Thank you for that introduction. And I am very excited to be here today to share the Taking Stock study. The Taking Stock study is a community engaged study that is highly collaborative with researchers at Occidental College and Columbia University, as well as community partners, Black Women for Wellness, and promotores de salud, health promoters working with Latina communities in South Los Angeles. And I'm excited to share some of our findings so far in this study and related to why we care for breast cancer. So again, I'm Robin Dodson. I'm working as an exposure scientist on this study, and I'm working at Silent Spring Institute. So first, a little bit of motivation for why do we need to study consumer product use among Black women and Latinas. Well, we know that women of color, particularly Black women and Latinas, are disproportionately exposed to many consumer product chemicals. Over on the right here, showing data from CDC's National Biomonitoring Program called NHANES. And if you look at this data that tracks kind of representative population of the US for chemical exposures, and separate out based on race and ethnicity on the right there, you can see that non-Hispanic Black women have substantially higher levels of methylparaben in this case than other women. And methylparaben is used as a preservative in many personal care products. And so we're really concerned about these exposure disparities that we're observing. Methylparaben is just one example. There are many consumer product chemicals in which women of color have higher levels in their bodies compared to others. And unfortunately, many of these chemicals are endocrine active, which means that they can interfere or interact somehow with our hormone system in our bodies. And exposure to these chemicals has been associated with a variety of hormone-mediated conditions like uterine fibroids, preterm birth, diabetes, asthma, immunosuppression, and even breast cancer. And unfortunately, we know that many Black women experience these health conditions at greater prevalence than other women. So this is looking at breast cancer incidence rates and mortality rates among Black women. You can see this is national data, and you can see here that while incidence rates of Black women have historically been lower than those of white women, they are now converging in more recent years. And unfortunately, we can see actually that the mortality rates are much higher among Black women for breast cancer than other groups. And so this also is further motivation to try to understand what could be some of the environmental contributors to these disparities that we are observing not only with the exposure data, but now also with some of the health disparities that we are seeing. So consumer products likely play an important role in environmental risk factors for things like breast cancer, for diseases like breast cancer. And I want to provide kind of a framework for thinking about consumer product use. First, as kind of a way as how we approach this. Consumer product use among women should be viewed kind of as in more of a kind of a systems approach, this kind of idea of thinking about all the contextual factors that might be driving some of these product use patterns that could result in disparate exposures and disparate outcomes. This is actually a framework that was put forth by two of my taking stock collaborators, Ami Zoda and Bhavna Shamasunder, and they termed it the environmental injustice of beauty. Here are some examples. So things like colorism might compel women of darker skin to start using skin lightening creams, which could increase their exposure to chemicals like mercury, which could result in some adverse health outcomes. Similarly, we could look at hair texture preferences. The Western Eurocentric beauty norms around kind of straight hair has led some Black women to start seeking using hair relaxers and other hair care products disproportionately more than other groups in an attempt to straighten their hair, which could lead to higher paraben exposures or other estrogen-like chemicals. And then, of course, odor discrimination. This is the odor discrimination that women might feel to be compelled to be greater use of intimate care products, which could increase exposure to things like phthalates and result in gynecological health issues. So within this framework is how I want to kind of approach this problem of trying to understand which chemicals and consumer products might be leading to these health disparities and what can we do about it. I just want to dig a little bit more into that environmental injustice of beauty with some data. This is actually data that came out of New York City many years ago, but they've seen this in other communities. But what they found in some biomonitoring work in New York City was they found mostly at what we call the upper end of the distribution, so at the 95th percentile rather than in the middle of the distribution. So those that are more highly exposed tended to be foreign-born Dominican women. And so they started following up with women, trying to figure out why some women might have much higher levels than others. And so they followed up with all women who had urine mercury levels above 20 micrograms per liter. And when they did that, there were 13 women, 10 of which were born in the Dominican Republic, 4 of which had levels well above 50 micrograms per liter. Their subsequent investigations found that the majority of these women are actually using mercury-containing skin lightening creams. So this is trying to kind of illustrate the example of the environmental injustice of beauty, of kind of cultural social factors that might be contributing towards wanting or perception of wanting lighter skin, and so using products that might actually expose folks to mercury, which could have health consequences. This is thinking about odor discrimination and drawing out an example here about use of douches, feminine sprays, and powders, as well as wipes and towelettes among Black women. And we see that actually use of these products, and I'll show you some data to support this, use of these products tend to be higher in Black women compared to other women, which can lead to higher exposure to DEP, which is a phthalate. This actually has been shown in a study looking at, again, that national data. And there was actually a really nice piece just last year in the Washington Post that really tackled and took head on this troubled legacy of feminine care products or intimate care product use. And really the racist history around their use and how it is actually leading to higher exposures and potentially health impacts among Black women. So now moving on to thinking about hair texture preferences. We did a study actually now just a couple of years ago that was looking at products that are used by Black women. And this data is the products that were identified came from a study in New York City. And so we tested products that are used by Black women for endocrine disrupting chemicals and asthma-associated chemicals. This was really an extension of some work that we'd done previously where we had looked broadly across product types at endocrine disrupting chemicals or EDCs in those products. When we looked at these hair products that are used by Black women, we found, first of all, that every single product contained at least one endocrine disruptor or EDC. most of the products contain many, 4 to 30 of these EDCs that we look for. And they're across a wide variety of different products, and products that might be used frequently by women. And many of these chemicals have been associated with a variety of health impacts, like endocrine disruption, of course, and asthma, but also could be have effects on reproductive development, and even some phthalates have been flagged as potential carcinogens. And this is really important. It's important that we do this kind of work. It was the first of its kind, really, and it's really kind of raising a kind of a red flag around further investigation into the use of these products is necessary and could be warranted. Now, a couple of our findings, right, besides the fact that we did find these chemicals in all the products that we looked at, we did find some of the products did contain chemicals that have been restricted by the European Union or flagged by the California Proposition 65 program as potential reproductive or developmental toxicants. And that's concerning. Some of these products have been marketed towards children specifically, containing these restricted chemicals. We also found that that parabens and fragrances were the most common in these products. This is helping us by doing this kind of work. It helps us start thinking about what kind of studies we would design to try to start pulling together some of the pieces of the puzzle there around product use, exposure disparities, and ultimately health disparities. So these types of studies that really kind of form the foundation, and the studies, including also the national biomonitoring data, really kind of are the foundation for the development of what we call the taking stock study. The taking stock study is started several years ago now. Again, highly collaborative project working in a community engaged setting. And our aim really is to document product use patterns among women of color, with a particular focus on Black women and Latinas living in LA. So we have 3 different aims for this project. The first aim is to do a broad survey. We did a broad survey of product use across women in California. The second aim was to take a more intensive look and a deeper dive amongst a smaller set of women living in South LA, an environmental justice community. And the third aim was to follow up with some product testing on some of the more highly used products that we were seeing in the study. I'm first going to share a little bit about our survey study. This I've shared actually previously on an MVCC webinar, so I'll go through this briefly, but did want to share what we were finding. So again, we surveyed women across California. It was an online survey across various race and ethnicities that women self-identified. And here I'm showing the number of products used at least once a day in our survey work, and the percent of respondents are over on the y-axis. Women reported using an average of at least 8 personal care products per day. These are 8 of the 54 that we asked about, so I think this is at least 8 in terms of the number of products that women are using. One woman, if you look all the way down towards the bottom right there, you can see one woman is using at least 30 products per day. And so this is important. The implications here is that women are using multiple products, and each of these products may contain multiple endocrine disrupting chemicals. We then took this data and wanted to look at differences or examine differences across race and ethnicity. This is important because one, it will help us try to understand some of those linkages between the exposure disparities, consumer product use exposure disparities, and health disparities. The other is that these data are some of the first on some women, in particular Asian women tend to be understudied in these studies. Certainly Latinas and Black women are also tend to be understudied in many of these consumer product use studies. So here we have some of the first data of its kind. And we can see differences in product use. Here I'm showing it by category, so right, cosmetics, hair products, so forth. We can see that Hispanic or Latinx women tend to use more cosmetics than other women. We can see that Black women tend to use more hair products or intimate care products than other women. There were fewer differences on the other personal care products, although Asian women tended to use fewer leave-on personal care products. We also looked at this kind of individually and found actually the biggest differences in product use when we look at each individual product type is between Black women and white women. 28 of the 54 chemical product types that we asked about they had significantly different use by white women compared to Black women. This is looking at hair product use, and this is actually a visualization of our data by a really nice program, actually, a project out of the Harvard School of Public Health. It's the Environmental Racism Project, where they've kind of used a visual approach to identifying some of the issues around environmental racism. And so they took our data from the Taking Stock study and they visualized it in an attempt to kind of communicate some of the findings. So here actually is looking at hair product use. We can see that conditioner use and shampoo use really didn't vary necessarily across racial and ethnic groups, whereas use of other products like curl creams and hair oils, shines, gels, that Black women tended to are much more likely to report using those products than other women. So those are the results from that first AIM, the survey of product use. Now I'm going to spend the rest of the time actually really talking about our study in South LA and working closely with Black women and Latinas to really try to understand perceptions, accessibility, and use of personal care products among those women. So I want to step back for a second and kind of share a little bit of my motivation or my goals in this study as an exposure scientist. I have spent my research career dedicated to trying to understand exposure to consumer product chemicals and then trying to do something about it when we see exposure disparities or health disparities. So I see some of the clear kind of goals around doing a deep dive into thinking about consumer product use is having a couple of things. One is that we can use these data so we can improve exposure reduction tips by making them more relevant for Black women and Latinas. And this is really important because relevancy is important if women are going to start using these tips. We also, this kind of deeper dive in thinking about consumer product use will help us identify key exposure sources for intervention. What we mean by that is that it will help us start thinking about, can we start designing studies to help us test whether or not some sort of exposure reduction strategy actually works. And I'll talk about one of those towards the end. We're also really interested in reducing what we call exposure misclassification in health-related studies. What I mean by that is that it will be difficult to find an association between a particular product use and some health outcome if you have a lot of kind of noise around the information you have around the use of those products. There could be an association that we could not find if you don't do a good study to find that. I'll talk a little bit more about that, but we call exposure misclassification is that basically you just can't figure out the signal from the noise, which could have implications when you're trying to do more health-based work. And finally, it's really important to gather this type of information to inform consumer product risk assessments. Consumer product risk assessments are typically done in the kind of the regulatory context. And it's important that subpopulations like Black women or other potentially vulnerable populations are represented with accurate data in those risk assessments. So first, just to kind of orient you to how this work is typically done, to assess relationship between product use and then associations with biomonitoring, so the levels of chemicals inside of our body. This is actually a survey from Silent Spring as part of our crowdsourced biomonitoring program that we ran a couple of years ago. This study enrolled over 700 people across the United States, and we did some survey work and collected urine samples, trying to look at what are some of the drivers of biomonitoring levels that we're observing in these in this population. So we typically ask that data, just like other researchers. We ask for that information by saying, did you use this product in the last 24 hours? Did you use toothpaste or mouthwash or lotions in the last 24 hours? And then we associate those responses with the biomonitoring data. This is looking at the biomonitoring data. So this is the parabens that we were measuring in our participants in the crowdsourced biomonitoring study. And the association between what we measure in the body for parabens and the use of body lotions. We can see here that the use of body lotion was associated for increased paraben concentrations among people who did not read product labels. This is really interesting because it does mean that, particularly for parabens, for folks who were able to read the labels, who looked for products without parabens in them, they could significantly reduce their exposure. You can still safely use body lotions as long as you scrutinize the ingredient label. And this is important. It kind of helps us think about, well, if we could educate people about how to read labels to avoid parabens, it could work to lower paraben concentrations. This was kind of one step forward, I think, in thinking about how we can do a better job of tying consumer product use to biomonitoring. And we could see a signal here by separating out avoiders and non-avoiders. In a small study of our 70 women, we wanted to do actually an even deeper dive, not just asking whether or not you avoid the products. We wanted to know what specific products you were using and what were the ingredients in those products that the women were using. So to do that, first, I just kind of want to share what the study design is. This is what we call the community science project, or the community science data collection phase of the taking stock study. I'm very deliberate in my terminology here, rather than using the term citizen science, which many of our community partners were not comfortable with. So in this community science phase, we worked very closely with Black Women for Wellness and a promotora, a health promoter, in living and working in South LA, to recruit 35 primarily Black women and 35 women who primarily identified as Latina. Over 1 week, we asked these women to use an app, which I'll tell you about in just a second, and to complete several surveys, and finally end the week by collecting urine samples. This is a pretty intense study design for these women, and I really think that it's important. The key here was working so closely with our community partners in LA. So, because I really wanted to know exactly what women were using, and because I really wanted to know what was in those products, we designed an app to collect that information, because a tool like this didn't yet exist in the research world. So here we created the Taking Stock app. A lot of its functionalities were being built off of Silent Spring's existing Detox Me app. But this app, this Taking Stock app, is a research tool that allows women to inventory their products and all of their products that they're using. So they enter in a product into the app, answering a couple of questions about that. Every time they use the product, they can log the use of it with a date and time. So we know exactly when women are using their toothpaste, or exactly when they're using their hair conditioner. We also ask women to take a picture of the front, just so we can verify the product, but also a picture of the ingredients on the back. We then took those photos of the ingredients from the back of all the products that women are logging, and used optical character recognition to create machine-readable text that we could create a large, extensive ingredient database. The YouTube link there on the bottom is actually just a link of a video actually that our community partner put together to help women understand how to use the app. We did this work during the pandemic. It was in early 2021, and so we had to adjust some of our protocols a bit, and so tried to think about ways that we could support participants in our study in a variety of different ways. And so that's actually why we pulled together this video, hoping that it would help women understand how to use the app. So we now have a very rich data set of product use, in product use specifically for groups of people who are often overlooked in the literature, namely Black women and Latinas. From these data, so we have 70 women using this app over a week. We had over 6,000 logs. That means 6,000 times a participant date and time stamped the use of a product. And we have over 1,200 unique products. What I mean by that, unique products would be, say, brand X coconut scent would be a different product from brand X fragrance free. And that's important. They are different products because their ingredient lists are likely different. Now, you can start doing that math. Wow, there are 70 women who logged over 1,200 unique products. So we have a lot of work to do around this, but it just shows the vast variety of products that people are using. So looking at that data a little bit more closely, this is actually day, so the use, the day 1, day 2, and so forth, that women were using the apps for all the users there on the y-axis. And the intensity of the color is indicating the number of products used that day. And you can see here that there's a fair amount of variety, even among individual users, right, or individual participants. Our product use does not stay static across every day. We can also see that some people have much higher kind of intensity of use of products than others. And this is important. It means that we need to move away from kind of like lumping people together or trying to kind of characterize them necessarily as larger groups, but look at some of the individual kind of variability in product use, because certainly some people may be much more high consumer product users and then could lead to higher exposures. So we have a large variety in actually use. There was also a large variety in the products that women were using. So I've already talked about how there are more than 1,200 unique products. If we now look at this by product type, breaking things down, say from hand and body lotion or face cream, moving all the way down to things like mascara. I'm just showing the top product types here. So on the bar chart, on the kind of more towards the center with the green bars, that is the number of products, unique products inventoried for that particular group. Whereas on the right, with the yellow bars there, those are the number of users that are using that product type. So for example, we had 95 hand or body lotions that were logged into the Taking Stock app by 58 participants. This is important because basically, like, simple math will tell you pretty much everybody's using a different body lotion. The other thing is that we know that some women are using multiple body lotions. You know, we have several women in the study who are using 5 or 6 hand or body lotions a day. That's not kind of surprising, right? You think you might have a different hand lotion from a body lotion or whatever. So, but this is really important because, you know, to me, it's indicating, wow, not all of these body lotions are alike, certainly. And actually, I can pull an example of that. This is a lotion A on the left and lotion B on the right. These are product ingredient lists for products that were logged in our study. These are real products. Lotion A has several chemicals of concern. It has formaldehyde releasers, it has parabens, it has other preservatives like BHT, it's got a bunch of synthetic fragrances in it. On the right, lotion B, totally different product, right? It's basically beeswax and more natural substances. So going back, this is kind of really kind of taking head on that the importance of addressing or reducing exposure misclassification. This would be a key example, right? The idea is if we just asked women, did you use body lotion today? they could be using very different lotions here. So it's really important that we ask more detailed information so we can do a better job, because it matters. It matters if you're a lotion A user, and it matters if you're a lotion B user. And with this type of data, we can do a better job of determining that. So something that we wanted to do, and this is part of sharing these results with participants, is that we screened these products for ingredients of health concern. There are about 30 of these ingredients that we screened the ingredient list for. We picked these ingredients, parabens, sunscreens, phthalates, things like that, because first of all, they were either targets in our biomonitoring study, so in our urine analysis. So that includes the phthalates and the phenols like parabens. They could be banned as cosmetic ingredients in California and now, fortunately, in other states. So those are things like the formaldehyde releasers. They could be, we're really interested in thinking about potential paraben substitutes. We think there's a lot of kind of movement in that space in the beauty industry, and we're trying to kind of track that. And of course, chemicals that have been previously flagged by our product testing work as endocrine disruptors or asthma associated, but we know they're kind of commonly detected in products. That includes things like cyclosiloxanes and ethanolamines. So what are we finding? So this is 70 women. They're logging their products. We're looking at the ingredients. So of the 70 women, all of them use at least a product with at least one ingredient of health concern. Most of these ingredients of health concern, most of these women get on this list because they're using fragrances. In fact, we have one woman who would not otherwise be flagged as having an ingredient of health concern if we took fragrances off the list. So everyone is using a product with an ingredient of health concern. The majority of women are using products with parabens in them. And then I found this interesting. More than half of women are using products with formaldehyde releasers. Formaldehyde releasers are important because they're put into products because they release formaldehyde, which is used as a preservative in the products, but formaldehyde is a carcinogen. So how would you typically see parabens on the label? You might see things like methylparaben, propylparaben, any kind of paraben, basically. It might also be written as a hydroxybenzoate. So for example, propylparaben can also be written as propyl 4 hydroxybenzoate. So these are kind of the how we were actually screening them and what you might actually see on a product if you wish to avoid parabens on the label. For formaldehyde releasers, we're talking about things that unfortunately don't actually put formaldehyde in their name, so they're a little bit harder to avoid. But DMDM, hydantonin, that was actually one of the more popular ones, as well as several ureas and quaternium 15. So all of the women were using products that contained at least one ingredient of health concern. For most participants, several of their products contain ingredients of health concern. So it's not just like at least one, it's actually several ingredients of health concern in the products that you're using. So here I'm showing the number of products. The lighter color is indicating the number of products that a participant is logging. The darker colors within those bars is showing the number of products that are flagged for having an ingredient of health concern. Particularly, actually, I took fragrance off of this because otherwise most of all those bars would be dark because of the widespread use of fragrance products. What's interesting here is that the percent of products that women are using, on average, 38% of those products contain ingredient of health concern. And to me, this means that we've got some work to do to help women choose healthier products. Let's look a little bit more closely at parabens. Parabens, as I said kind of at the beginning, are often used as preservatives in many products. In our product testing work, we typically see them on products that touch the skin over and over again. And we can see here that parabens are used in things all the way from toothpaste, sunscreen, shaving cream, all the way down to more cosmetics like eyeliners and eyebrow products and things like that. going back to those lotions, of the 95 lotions, 27 of them contained parabens. I'm not sure if I'm surprised by this. I mean, I think if this study was done, right, this study was done in 2021. I think if the study was done maybe 6 years earlier, it would have been even higher. I do think there's probably some shifting away from paraben use, and that's something we're really kind of looking at, but it's still a pretty big number. If you were trying to go out there and trying to find a paraben-free lotion, there are some options, but the market certainly has some that still contain parabens out there. This is looking at formaldehyde releasers in personal care products. I think this is really important to think about. I think formaldehyde releasers are often overlooked. They have been the target of several cosmetic ingredient bills that are banning chemicals, which I think is good news. But we're seeing formaldehyde releasers in anything from like hair products are certainly prevalent, but also in things like facial soap or face creams that people are putting on their face perhaps every day. 4 of the 19 hair gels, most of these hair gels are marketed towards and used by Black women, contain formaldehyde releasers. Again, this will be listed on a product ingredient. Product list is something like DM-hydrotonin is the most common, as well as several ureas. And it's important for thinking about developing exposure reduction tips to really kind of concentrate on these formaldehyde releasers. And it's something that we are incorporating into some of our tips. So I mentioned this before, but we are sharing our study results with participants, right? Silent Spring has a long history of sharing the data collected in environmental health study. We believe it is the right thing to do. We have developed the tools for that. We developed a tool called Derby, the Digital Exposure Report Back Interface, which is meant to kind of help or facilitate researchers sharing their study results back with participants. For this taking stock study, we actually expanded our report back to include report back on product ingredient scans. Because we had this rich data set of all the ingredients and products that women were logging or using, we then scanned them for those, screened them for the 30 or so ingredients of health concern that I showed you a couple slides ago. This is one example of a table that participants are seeing in their reports. They see, for example, that their face cleanser might contain parabens, or that there might be other preservatives and things like their body sprays, and of course, fragrance being the most commonly reported ingredient in many of the products that women are using. This is important. It's important we are deliberate in actually naming the product, mostly because it's important for communication with participants so they know exactly which product they were using that contained the ingredient of health concern. So they can think about whether or not they would like to make replacements in what the products that they're using. So what is this kind of deeper dive, this the app data, the Taking Stock app data, what is it telling us? Why is this really important? Well, I do think that this app data, this kind of rich data set that we're getting from it is really important because we know that Black women and Latinas face greater cumulative burden of many exposures. These women are also living in an environmental justice community. So they face greater cumulative burden, not only from the products that they're using, but from where their homes are situated. It's really important that we have a better understanding of exposure to consumer product chemicals in order to develop exposure reduction strategies. I think the formaldehyde releasers are a really important example here of a place where we are developing more relevant and honing and doing a better job at talking about how you could go about reducing your exposure to formaldehyde releasers, for example. It's also really important to have this kind of data so that we can reduce exposure misclassification. I gave that example on the lotion A and lotion B. Those products are not the same. If you were to just ask, did you use lotion? It might be difficult to find an association between paraben-related body lotions and those without parabens in them. And so I think we need to move the consumer product research kind of forward to collecting this more detailed data. We also know that community-based research will help improve consumer product risk assessments. And this is really important to protect vulnerable populations, including women of color. So what are we doing now? I have just described some of the steps as part of what we call Taking Stock 1.0. That was the first phase of the study that started in 2018 and extended through the pandemic. Taking Stock 2 has started and what we're doing for that work is actually an intervention study. This is something I'm very excited to be starting up. We have not yet recruited. We are just starting to do this work. And getting all the protocols in place to do this. But this is really kind of born out of what we were seeing in the first phase of Taking Stock. And we're choosing to focus on Black women who have recently transitioned away from using chemical hair straighteners. And we want to support them as they're choosing healthier hair products to maintain natural hairstyles. We're doing this support in a variety of different ways, not only from a technical side by helping women identify products that might be healthier, meaning they have fewer ingredients of health concern, but we're also have integrated into this intervention study a lot of community supports. We are hiring a natural hairstylist to help women. We know this is a big change to go from use of chemical hair straighteners to maintaining a natural hairstyle. And so offering things like a hairstylist, we're making these community forums where women can share their experiences, share what products work, what doesn't work, what are the best protective hairstyles to use, and so forth. So this highly supported intervention study is going to take place over 6 months. We're going to start off with some baseline work just to understand where women are at, using surveys, interviews. They'll be using the app again. They'll be doing some biomonitoring, so urine samples. Partway through the intervention, so halfway through the intervention at 3 months, we will again do a survey work, ask people to inventory their products and collect urine samples. Then at that point, so we're very much focusing the beginning part of the intervention on supporting healthier hair products. That's mostly because we want to kind of get women on board, teach them, educate women about how to choose products. We then think that there likely will be some sort of kind of spillover into the other products that women might be using. So the rest of the intervention is focused on healthier all beauty products, hair products and personal care products, cosmetics, intimate care products, and so forth. After the full intervention, again, we will collect information through surveys, interviews, product use, and biomonitoring. This is a long intervention, but I think it's really important. It had to be this long in part because of the frequency of use of many of these products and to help women make changes and then transition. And I'm really excited about this. We're just getting all our protocols in place and hope to start recruiting women this fall to take part in this. This will be Black women living in Southern California. Another project that I want to kind of drop in here is not totally related to the Taking Stock, but it is certainly motivated by the Taking Stock study, and it's work that actually postdoc Alicia Franklin from Silent Spring is leading. It's called the Power Study, and it's really cool. It's now that we're doing a whole bunch of research on these products, on exposures, disparities amongst Black women, we want to share that information. And so she's got this project called the Power Study, which is engaging social media influencers to share the research. These are just 2 examples here. And we've had a fair amount, a pretty good impact, right? So just in our first phase of that study, we actually recruited just 10 social media influencers and had over 100,000 views of the information. That's hard to do with a handout or a pamphlet, right? It's a way to reach women and a lot of women, and also really proud of the number down there, 1,700 plus shares, which means we don't know the potential reach of that. That means people wanted to tag that, share it with somebody, read more about it later, and that's really encouraging in terms of getting the word out. So I like to kind of wrap up all my talks with kind of a call to action. And I think that this action should happen at a variety of different scales. I never want to say that the onus is on the consumer or the participant to choose better products all by themselves. I don't think that's fair. I don't think it's right. I think we need to take a larger kind of systems approach to this. I think it needs to expand everywhere across consumers, institutions, retailers, and all the way to regulations and policies. Things like supporting people to make better, healthier consumer choices, engaging with institutions like higher ed or the healthcare industry, to working with retailers and manufacturers, thinking about kind of phase out campaigns or marketing's advantages, and also thinking about regulations. I want to give 3 quick examples along this spectrum of things, of actions to take. The first is download our app called Detox Me at Silent Spring. We have compiled nearly 300 research-backed tips from all of our exposure work over the last couple decades in an app called Detox Me. It's free, it's in Spanish and English, and it's really meant to support people trying to make a healthier home or a healthier kind of daily life. So it's called Detox Me. Some of the top tips are to look for paraben, phthalate, and fragrance-free products. Choose quick drying nylon shower curtains. Avoid vinyl in your house if at all possible. Avoid chemical sunscreens. Many of those chemical-based active ingredients in sunscreen are hormone disruptors. Avoid packaged food, opting for more fresh ingredients. Keep dust levels low. I can tell you all about a bunch of household exposure work that we're doing and how we're finding many of these chemicals of concern hanging out in the dust in our homes. So using things like a vacuum with a strong HEPA filter. Avoiding things that are marketed as stain resistant, water resistant, to avoid those PFAS chemicals or antimicrobial. On a kind of a more marketing perspective or engaging retailers, this is a project that called the Non-Toxic Black Beauty Project that is engaging Black-owned beauty companies to make healthier products. It is led by the Campaign for Safe Cosmetics, but Silent Spring serves on their advisory board, and they've created a database for consumers and resources for consumers like tip cards to help women choose healthier hair products. In this case, the arrows there are just indicating the two formaldehyde releasers that we were finding in many of our products, and really trying to move the Black beauty industry towards healthier products. So I encourage you to check out that project, engaging retailers and manufacturers. From a regulatory perspective at the national level, of course, there is a Safer Beauty Bill package that is working to try to ban particularly harmful ingredients, protect communities of color and salon workers, really trying to work to enhance transparency, not only in the supply chain, but also amongst flavor and fragrance ingredients. So you can check that out. A resource by BCPP, the Breast Cancer Prevention Partners are working on these a lot, as well as a lot of other nonprofit organizations and advocacy organizations. So with that, I want to say thank you. I want to acknowledge all of my wonderful collaborators on the Taking Stock study. I am just of one on a team of wonderful women working to advance consumer product research so that we can address exposure and health inequities that we're seeing. And of course, acknowledge the funding. And please reach out if you have any questions. Thank you very much.
Dr. Dodson, thank you so much for sharing what is really an incredible spectrum and well thought out and detailed research with us. Thank you so much. I want to invite any of our participants on today's webinar. If you have any questions that you would like to have answered by Dr. Dodson, you may use the question feature in your GoToWebinar panel, which will appear on the side of the webinar screen. And there's a questions section and a small icon. Click on that and you'll be able to type your question in. While we're letting participants think about their questions, Dr. Dodson, could you explain to me as a layperson, why is it important to engage a community pattern in this type of research?
Yeah, so this is, I didn't stress it enough here, but right, the community partnerships that we have are extremely important. We were we were asking a lot of these participants to collect a urine sample, to use an app for a week, and really could not have done it without our wonderful partners at Black Women for Wellness and our local promotor food. I think they are critical and really important in gaining trust amongst folks, amongst participants. And it makes me have more confidence in the data that I'm collecting, that it's real, that it's really, it's data that really is representative of the community. And so I think it's really important to do this kind of work in strong community, with strong community partners. And I'm not sure it otherwise could be done, honestly.
Could you also, tell us a little bit more about what you mentioned with regards to intimate care products? Why are those products particularly important that you're studying?
Yeah, so as an exposure scientist, I'm particularly concerned about intimate care products because, well, we use them intimately. They're used, around our vulval region or our vagina, where there is very sensitive skin, and so I do think that the exposure potential is really high, and something I didn't share here necessarily, but we are finding that some women are actually choosing to use fragrance like menstrual care products. It's a small number; it's about 10% of our in the survey. But that's important because those fragrance chemicals, we don't know a lot about them from like what exactly those chemicals are, but there is a potential for exposure there to chemicals that we would be concerned about from a health perspective. Also, I think in thinking about intimate care product use, we need to understand like what are the drivers for some of that intimate care product use, and that is some work that we are following up with that Ami Zoda is leading, as well as Alicia Franklin at Silent Spring, and that's, I think, really important to have a better understanding of why women are using those products. To support them maybe transitioning away from the use of those products because we are so concerned about the potential for exposure to harmful chemicals.
Mhm. I just want to acknowledge that we didn't get a question, but Elizabeth wanted to thank you for very useful information. Um, Intervention studies can be tricky in that participant buy-in or engagement is critical for them to be successful. How is Taking Stock 2.0 set up to support participants?
Yeah, so I touched on this briefly, but I do think that it's really important, especially over a long intervention study that we've designed over 6 months, that and pretty intense, right? We're asking a lot of these women. Is that we've set up kind of a multi-levels of support, right? I talked about that we have a hairstylist that will be there to support women to maintain natural hairstyle. We have folks on our staff who will be helping women select products. There'll be a kind of a community forum to help women to talk to each other about what products are working, what's not working, and so forth. And I do think that really, and this actually comes out of some kind of a review paper that I contributed to around interventions. The successful interventions are those that are highly engaging with participants, meaning they don't just like hand something off and say, can you do this for the next 2 weeks? They work with participants, they support them. There's a lot of engagement, and that's what's going to make a successful intervention study. And I hope we're setting ourselves up, I believe we are setting ourselves up to have a very successful intervention because we've built in not just the kind of the research support for the intervention, but also the community supports into the intervention. So that we can support women to maintain, hopefully, use of healthier products to maintain a natural hairstyle.
You just mentioned something around community supports that will help shift the perspective of maybe even why we use these products in the first place. and then to use, like, make better choices, right? To choose healthier products. And it really is a reference to a cultural shift, right? Because your research points out that there are definitely ethnic and racial disparities. Um, but I think all women could identify with the work because we have received those cultural messages that indicate what is considered beautiful, what are products women should be using. The idea that fragrance, I'll never forget the one slide you shared where it was like, everybody's using these things. Everybody's got something they're using that is impacting or potentially impacting their health by increasing their level of exposure. So when you're doing this work and it's obvious that you're very passionate about it. I've caught on to that, and I want to, like, join with you on being passionate about this as a concern, but it also relates to the messaging that has overtones of racism and sexism within our culture. So thinking about that as this kind of moral imperative, how do you go about building that community of support that we're actually shifting the cultural concept that we need these products in the first place?
Right. Yeah, no, that is a great question. And I want to be very clear that I would never am kind of like placing the blame on the user or the consumer in this way in any way, right? That this is actually a systems problem. And so we can support women as they're choosing healthier products. That's one part of it. But I do think that we need to work upstream too, and work in ways that support non-discrimination policies, right? So Black Women for Wellness, our community partner, has worked strongly on pushing the Crown Act, which has been passed in many states, first in California and then in many other states. But the Crown Act says that you can't discriminate against hairstyles. It's amazing to me that until about 5 years ago, you work in a workplace, you could discriminate or tell people how they should wear their hair, and you could do that at schools and educational settings. And thanks to things like the Crown Act, we can start kind of tackling things at that level, at the regulatory level, at the policy level, so that we're not compelling women to having to use harmful products, so they have to kind of meet some sort of workplace expectation about how they actually maintain their hair. And I think that's really important. Like the military only about 5 years ago allow women now to maintain different kinds of hairstyles. They don't make Black women straighten their hair. And that is really, really important. So we need to think about interventions at all levels. I talked about intervention that's working at just the personal level, but I think we need interventions in the marketplace. We need interventions in the policy space as well. And it's with all of that together, can we actually tackle these issues?
Because we're Massachusetts Breast Cancer Coalition, and we always like to feel that we can empower our viewers and our supporters to take action for themselves and for others within their community. What do you recommend to the participants who may be listening in, people like myself? What are the action steps you would recommend that we take today to decrease our potential exposure to these harmful chemicals?
Sure. Yeah, I think the first thing you can do is like download our app, Detox Me. There are others supports out there too, but I think something like Detox Me is a great first step in helping to support people choose healthier products. I do think you should get involved too. I mean, we get involved in policies, vote, make sure you're active in voting and electing people who you believe will put forward regulations and policies that will actually take these chemicals out of products that we use every day.
I want to thank you so much, Dr. Dodson. What a fabulous presentation, a great way for us to kick off a new season of webinars here at MBCC. On behalf of myself and the MBCC board, Cheryl Asimo, MBCC's Executive Director, I want to thank you deeply for this very informative discussion today, and I want to thank all of our listeners for joining us. For those interested, the recording of this webinar will be made available later today on the MBCC website at mbcc.org. Have a good afternoon, everyone.